Good morning. On behalf of CEOM, European Council of Medical Orders, I must thank the honorable invitation to Dr. Nikos Nitsas, President of the Medical Association of Thessaloniki, Dr. Athanasios Exatilos, President of Panhellenic Medical Association, and all organizing committee, and at the same time greet the assistant of this meeting. CEOM is leading in Europe since 2016 the issue on violence against and burnout among doctors, medical students, and other health workers. As whose definition, all persons have the right to work in a safe environment without the threat of violence, and workplace violence includes both physical and psychological violence. To mark the 12th of March as the European Awareness Day on Violence Against Doctors, medical students, and other health professionals, CEOM support by all EMUs prepared an update about all the work carried out by CEOM during these last years and to be released today all around Europe. This document, 12th of March, European Awareness Day on Violence Against Doctors and Other Health Professionals, that I'm going to present now, you have received by all CEOM members, and I hope you can disseminate it today. A. Considering an unanimous observation by medical associations in Europe of an increase of verbal and physical aggressions. B. The inflection of violence is the reflex of the incapacity of healthcare systems to face new health paradigm. All health professionals have the right to work in a safe environment with no physical or psychological risks. CEOM EMUS proposed two key points for the future to improve and avoid the harmful consequences of violence and burnout among doctors, medical students, and other health workers. 1. We strongly require a zero-tolerance policy towards violence in the workplace. 2. We must encourage doctors and health workers to report acts of violence against them. 3. Continue awareness-raising campaigns on assaults on health workers and their consequences. 4. Strengthen preventive measures by increased security measures in healthcare. 5. Develop, on the part of the administrations, training and coach on how to deal with verbal, physical, or psychological violence and possible bases on burnout. 6. Consider professional burnout as a type of psychosocial violence that doctors and medical students face in their workplace. 7. Leadership development as a way of improved work conditions, better physician-patient relationship, and decreased incidents of violence and burnout. We must develop, at the level of health service management, a culture of consideration and recognition of the violence against health professionals. 8. Strengthen communication and agreements with health administrations, the public prosecutors officers, and the state security forces for a comprehensive approach to the aggressions. 9. Call for the enactment of a specific law and consider priority crimes to address violence in the health sector. 10. Ensure that judicial procedures are swift, expedite, and exemplary. 11. As approved on the last CEOM meeting in Paris in 24 November 2023, we must disseminate and implement in the member states our unified European forum to collect data on violence against doctors and their staff. It's now the golden standard of our organization. 12. Promote resilience. CEOM and EMUS recognize the ugly negative impact that violence has on social, physical, ecological well-being on doctors, the care received by patients, and its contribution rising levels of burnout experienced by doctors, medical students, and other health workers in their workplace. We must continue together in this battle because violence and burnout are a constant scourge on our society. In this context, we must highlight the new Greek law for violence against doctors, which will certainly be another deterrent in the fight against violence. In my personal name and as CEOM president, I thank again this invitation and congratulate this excellent organization and this useful discussion. Thank you so much for inviting me.